Welcome to the Social Drivers of Health Screening Platform tutorial. This short video will help you accurately and effectively conduct an interview to screen for individuals at risk due to an SDOH, Social Driver of Health. This is a simulated SDOH screening at the Don Bosco Health Center in Kansas City, Missouri. During this short video, we will describe the value of SDOH screening, perform an SDOH screening, and demonstrate how to submit the form to MARC Aging and Adult Services for scoring. The video will prepare professionals to use the SDOH screening tool for the SDOH project at the Mid-America Regional Council. First, we would like to provide some background and value of SDOH screening. Social Driver of Health, SDOH, are the conditions in the environment where people are born, live, learn, work, play, worship, and age in a community. These drivers affect a wide range of health, functioning, and quality of life outcomes and risks. SDOH screening initiatives are in response to value-based care trends. Social Drivers of Health screenings help clinicians and organization leaders understand the social issues affecting the health and wellness of the organization's unique patient population. The Centers for Medicare and Medicaid Services use the acronym HRSN to define the 5 specific social needs that we look for in the screening process. HRSN means health-related social needs and includes food insecurity, housing instability, transportation needs, utility difficulties, and interpersonal safety. Any of these HRSNs may lead to negative health outcomes. Public health organizations such as Area Agencies on Aging, also known as AAAs, and their partners in sectors like senior services, education, transportation, and housing can take action to improve the conditions in people's environments. Social service organizations in our communities offer social supports that can significantly decrease SDOH risks such as transportation, home-delivered meals, in-home aid services, and information and referral for additional resources such as utility assistance, financial planning, and child care. That is the purpose of SDOH screening and this tutorial. In order to ensure that we're providing as much support as possible, we need to assess the needs of our community members in a systemic manner and provide resources as indicated. Evidence-based SDOH screening tools can be utilized to assess risks and identify needs. Service providers can then provide support and help participants access the services and resources that they need to stay healthy in the community. We will now walk through the steps in the screening process. We will be using person-centered approaches that take SDOH into consideration, recognizing the needs of the community member being interviewed. That means that we want you, as the interviewer, to use a conversational tone. You will be asking questions and providing responses, but you may need to ask them the question in different ways. Listen as they respond and pick the response that best matches their answer. For example, the first question is, "What is your living situation today?" You may want to say something like, "Tell me about where you live." If you hear key words such as, "I'm worried about," then you would select a response that matches their situation. Continue through the questions in a conversational manner and check in with the participant to ensure they understand your question. Pay special attention to questions about utilities or support mechanisms. They may not understand what some of these resources are. For example, we will ask about internet access and digital connectivity, which may be very beneficial. But you'll need to probe their response to confirm that they are connected digitally if they report they are. You may need to repeat what you hear without judgment. Some participants may change their response if they feel you're too concerned about their situation or have judgment about their personal life. Finally, be particularly sensitive when asking about personal safety. They may not feel comfortable sharing their concern with someone they recently met. Watch for signs of stress, and if necessary, find someone who is well known to the participant to ask these questions. After all the questions are satisfactorily answered, submit the form for scoring at MARC Aging and Adult Services. At the end of your interview, be sure to thank the participant and provide some sense of what will happen next. This is simply a screening. After it's evaluated and scored, a member of the community organization or a member of one of the area agencies on aging will follow up and support the needs identified in the screening.